In Module 1, we will define pressure injuries and discuss their risks and impact. A pressure injury is defined as localized injury to the skin and/or underlying tissue that can happen almost anywhere on the body, but most often they occur over a bony prominence as a result of prolonged pressure, friction, shear, or a combination of all. They can also be related to medical devices or other objects that can cause pressure. Pressure injuries can present as intact or open skin. Staging is used to identify the extent or the depth of tissue loss and the physical appearance of the injury. Staging should be performed using a standardized staging system. Pressure injury staging determines the extent and depth of tissue damage according to the involvement of the epidermis, dermis, and other surrounding structures. It can then be documented and conveyed with other care providers. Additional pressure injuries include unstageable, deep tissue, medical device-related, and mucosal membrane. These will be covered in depth in Module 3. Pressure injuries continue to be a growing healthcare concern as they can lead to longer hospital stays and higher rates of readmission. Here are some surprising facts. Many pressure injuries develop within the first week of admission, and some can happen in as little as 6 hours. In a global study of 90 countries, 59.2% of pressure injuries were ICU acquired. Pressure injuries can also add an additional 3 to 7 days to a patient hospital stay, as well as increased rates of readmissions. One of the consequences of pressure injuries is the cost associated with treating them. In the U.S., $11 billion is spent on pressure injury management. The cost of treating a single pressure injury varies greatly depending on severity, with one full-thickness injury costing up to $70,000 to treat. Beyond the economic concerns for many care settings and in many countries, pressure injuries are viewed as a quality indicator. Pressure injuries that develop or worsen during a facility stay may be considered hospital-acquired and may be published on a consumer site as a metric for quality comparison. They may also be tied to financial penalties, or the care associated with treatment may not be reimbursed. This is important because pressure injuries are considered a quality of care indicator. Understanding a patient's concerns is very important. Pressure injuries can impact quality of life due to added stress, clinic visits, and invasive assessments and treatments. In addition, there is also a risk of complications associated with pressure injuries, including infection, pain, and extended length of stay, not to mention out-of-pocket expenses and restrictions placed on mobility. The realities of providing care during a global pandemic has added a new layer of complexity for the prevention and management of pressure injuries across the healthcare setting. Extrinsic risk factors, or risk factors that are external or environmental forces, include pressure, friction and shear, and moisture. Pressure from prolonged medical device use like ventilators and brush blood pressure cuffs add additional risk. Intrinsic risk factors, or those factors originating within the patient, include previous pressure injuries, impaired sensory perception, such as patients unable to feel due to neuropathy, spinal cord injury, or cerebrovascular accidents, extremes of age, diabetes, impaired perfusion, and weight are some risk factors beyond a clinician's control that can also contribute to a patient's risk of developing a pressure injury. Certain populations of patients are at greater risk. This includes those with limited mobility, those in long-term care, and those with spinal cord injuries, hip fractures, and traumatic injuries. Underlying comorbidities such as diabetes also increase risk. Unfortunately, there is nothing that can predict how long it will take for a patient to develop a pressure injury. This depends on many additional factors, including the intensity of the pressure and shear forces, the duration of these forces, and the susceptibility of the patients. Thank you for watching Module 1, where we defined pressure injuries, staging, and risk factors. We hope you will join us for the next module.